Hey guys, welcome back to Scanning the Mind. For those of you who are new here, I'm Varun. I'm a radiology trainee in the UK.
My name's Sanchit, I'm a psychiatry trainee in the UK. Now, a few of you have been sliding up in our DMs, asking for more radiology-related content. And it just so happens that Varun was on call for the first time in radiology, so we thought we'd make a video about finding out about what happened. So I think a lot of people are aware of like what medical on-calls entail, and that's kind of the standard on-call people do, or surgical on-calls. But what is a radiology on-call?
Yeah, I didn't know before I started radiology either. I just assumed, they report the scans and that's the end of that, which a lot of people would still assume to be the case. So essentially what that means is during those 12 hours of the day, any imaging requests need to go through us as the radiologists. Any images that need reporting are reported by us. So yeah, any imaging on the weekend, we're involved. When I say any imaging, I mean any imaging. So if the surgeons need an urgent scan, they have a chat with us. The radiographers obviously do the scan and we have to report it. Any major traumas coming to A&E, we have to report them and protocol them. Ultrasounds, kids, adults. Luckily, as a junior reg, I don't do them yet.
Okay.
But the senior registrar has to do them.
Report them.
Do them. So you do the ultrasound and...
Oh, fine.
I know actually in America apparently, sonographers don't report the scans.
Okay.
So apparently, I might be wrong, and correct me if I am wrong, comment below. But apparently in a lot of places in America, the sonographers will take the images, but they won't interpret them.
It sounds like it'd be easier to interpret when you can actually do it yourself.
That's what I'd assume.
Yeah.
But obviously here the sonographers will interpret and do the imaging. But on the weekend there's no sonographers.
So
we
senior registers have to do all the ultrasounds themselves.
Yeah.
Fine.
Which...
it's quite daunting, especially on kids. Anything to do with kids is just automatically more scary.
I'm so happy. As soon as it's ultrasound kids, I'm just like, here's the phone. I'm just like, take the phone please. I don't want anything to do with this. But next year that'll be me.
So it sounds like quite a stressful time, especially for your first on-call shift.
Yeah.
It's not like you've ever done it before.
Nope.
Were you nervous beforehand?
Yeah, 100%. I think anyone who says they weren't nervous is lying.
Yeah.
So it's a lot of responsibility. As I'm sure people know, nowadays any patient who walks into the hospital is going to get imaging.
Yeah.
And realistically, if they're unwell, the imaging is going to dictate how the patient's managed. And like I said earlier, I'm at quite a big hospital at the moment, so we have like major traumas coming in, people getting stabbed, people falling off buildings, high-speed RTCs, tertiary surgery services, which are quite niche. And if my senior reg is doing ultrasounds of peds and my consultant's busy, they'll just come and talk to me.
Yeah.
And it's a lot of responsibility to have. Like, if I miss something and something happens to the patient, that's on me. So I was very nervous going into it, but equally I was looking forward to it because you get to learn quite a lot.
Yeah.
The only way you can really learn in radiology is just doing things. It's the same as anything else. There's obviously support there if you need it, and it's quite good to feel useful. As a first year radiologist, you often feel quite useless because no one needs you. You just slow people down. So now to actually get people coming to you asking, oh, what do you think of this? Can you report this? It feels quite nice.
I guess it's similar to your first on-call as an F1, but just with way more responsibility.
Yeah.
Because as an F1, you've never done the job before, you're going to have to take more responsibility and actually feel useful for once. Yeah. And you're kind of by yourself, just like running around doing stuff. Yeah. So it's the same, but just like the stakes are way higher.
Yeah, that's kind of what it felt like. I had the same feeling walking into the hospital as I did before my first F1 on-call. Except I remember thinking, if I make a mistake, it's not going to be a small deal. But like I said, you have the support there. My senior reg who I was on with was very helpful. The consultant I was on was really sound.
How do you split the work up between you guys?
So, yeah, three of us, like I said, myself, senior reg, which can often just be 1 year above you. Yeah. They do know more than you, obviously, but it's not that much more senior. And a consultant, and myself. So consultant, senior reg, and myself. So typically you and the other reg will be sat in the same room with a phone between you, and your main job is two things: A, answer the phone, and B, report the scans. So the phone rings for various things. So it'll be clinicians asking for scans. It'll be them asking questions about scans that have already been done, and it's them asking logistical questions of, how do I get the scan done? There's this problem. Can you facilitate it? Yeah. So that's one thing, and the other thing is just reporting. So yeah, you work your way through that between the two of you. The consultant sits in a different room, not because they hate you, but I think it's because their job is to check your scans. Yeah. And scans from the night before.
Oh, wow, okay.
Yeah, so they basically work behind you. Because, fine, I release the report once I've reported something, but if I've made a mistake, which I easily could at this stage, if they don't check that pretty soon, it could have life-changing consequences.
Where all those addendums come from.
Yeah, so when we release the report as Regis, we have a little bit at the top saying this is a provisional report, please check, for the final report, and it's your responsibility to do so. So he or she just works behind us, and like I said, there's a registrar on call the night before.
Yeah.
They have to check their work in the morning, then they have to check my work, and they have to check the other reg's work. So they're basically doing the job of 3 trainee radiologists.
Yeah, over a 24-hour period.
Yeah, and sometimes they're on call 48 hours. So
that's a lot.
Yeah, it can get quite bad for them, I imagine.
How often are they doing those on-calls?
I don't know. I think it depends how big a department you work in.
Okay.
I know in some hospitals in the UK, they don't do nights anymore.
Okay.
Because there's not enough radiologists to have a workforce during the day and at night. So they just do teleradiology overnight. Sounds like an easy solution, but the problem with that is the reports can be a little bit dodgy sometimes.
Yeah.
So oftentimes, the surgeons will come back in the morning saying, these 4 scans were reported overnight, can you report them again because we don't read the reports? Which you just think, what's the point then?
Yeah.
But where I work, there are enough radiologists. I don't know how often that happens.
Okay.
Yeah, I don't know.
Fine.
I don't know. Yeah, but that's how the work's split between us. The consultant does get phone calls, oftentimes if it's like some senior surgeon with a very niche problem, he or she knows that I'm not going to be able to answer that.
Out,
So they just bypass us completely and just call the consultant on the mobile.
Fair enough.
But most of the phone calls come through to us.
So how did it go?
You know what? I actually quite enjoyed it.
Oh. Okay.
Like I said, I was looking forward to it because it's a great learning opportunity.
Yeah.
I'm going to be doing this job for 30, 40 years, so I want to get good at it as soon as possible.
It's a good thing you enjoyed it as well.
I know, exactly. I wasn't feeling great, actually. It wasn't COVID. I took a test. But I wasn't feeling great. But apart from that, yeah, it was good. Got along with the registrar. The consultant was really nice.
Yeah.
Bought me chocolates.
Oh, right.
Both days I was like, this is some...
What more could you want?
I know, literally, what more could I want? I did annoyingly make a few mistakes. Which I was a bit annoyed about because there were mistakes that I kind of knew. Okay. But because the phone was ringing so much, which I'll talk about. Yeah. It's quite hard to then concentrate between the two. Yeah. So I missed a few things, which luckily the consultant was there to have. The consultant had my back, luckily. Okay. And picked them up pretty soon after, and they weren't management changing things.
And you are an ST2, so you're still basically learning how to do
this job, absolutely. I think there's a saying that if you're not making mistakes, you're not reporting enough.
So you mentioned you reporting scans. Are there any specific types of scans you report, or is it just everything?
So in theory, it's everything, but to be realistic, it's 99% CT scans. Okay. So that's anything: CT heads, CT PAs for blood clots, CT abdo-pelvises, CT traumas, anything. You do get the odd request to have a look at an X-ray, far and few between. Yeah. Over the weekend, I had maybe 3 or 4 requests like that. Okay. MRIs, technically, you can get.
Okay. I know a few hospitals I worked at didn't do any MRIs over the weekend.
So we do where we work, unfortunately. I say unfortunately because I can't report MRIs yet.
Oh, right.
As in, there's no set limit of where you should be able to report them.
Yeah.
But I've just not looked at many.
Oh, okay.
And the only real out of hours MRI that you do is for cauda equina.
Oh, fine. You don't want to be messing around with that. No.
I'm not practicing on somebody's cauda equina. Yeah. So yeah, that tends to go to the consultant.
Okay, fair enough.
And you don't get many of them.
Yeah.
Over the weekend.
It's quite an urgent one as well. It's not something that can like wait for the consultant to have a look at.
No, no. There's no waiting around even for CT scans because we just release the report, and then the clinicians see the report, and then the consultant looks at it afterwards. And if there are changes, he or she just makes them.
Okay.
So the same thing would apply for MRI scans, but realistically, as an ST2, I'm not going to be able to report an MRI spine at the moment anyway.
Fair enough.
So yeah. But yeah, apart from that, ultrasounds, there were quite a few requests on the weekend. Like I said earlier, the senior regs tend to do them. Felt quite bad for my other reg. She had to do 15 ultrasounds over the 2 days.
That's a lot.
So a full ultrasound list is normally 7 patients. So she's done 2 lists over the weekend on top of being on call.
Yeah, on top of all the reporting.
Yeah, and on top of the phone calls.
Oh my god.
So she was busy.
Yeah.
Yeah.
That's intense.
It was an intense weekend, but it was quite fun.
Was that quite normal for you guys, or was that a busy weekend?
I think where we work, that's quite normal.
Okay.
There are hospitals that I know other people work at that are a fraction. I know other hospitals aren't as busy at all, but just where I work at the moment, it's a big hospital.
Fair enough.
So I think that's pretty standard.
I guess it's a good experience.
Oh yeah, exactly. Like, I'd rather have this now, where where not much is expected of you,
Yeah.
than to be thrown in there like ST4,
Yeah.
and they're like, what are you doing?
Yeah.
You don't know what is
Why are
going
you not
on.
prepared for this?
Well, yeah, exactly.
Yeah.
So I was quite happy that I was there.
Was there anything that took you by surprise for your first on-call?
Yeah, so I think, so I was expecting the on-call to be busy, just because, you hear from word of mouth.
Yeah.
So I was expecting a high volume of scans, but what I didn't expect to that degree was how many phone calls you get. So to put into context, at one point, the other reg had to leave to do ultrasound, so she was gone for like 4 or 5 hours. And honestly, but for 4 hours, I got a phone call every few minutes. It's like every 5 minutes the phone just rings. And it's the most frustrating thing in the world because you're halfway through, not even halfway through, you start reporting something. Like a CT trauma can maybe take me half an hour, if not a bit longer. You start looking at things, your phone rings. They're like, oh, can you look at this for me? You have to close the patient you're looking at, go into a different patient, answer their question, go back, then you go back to the original scan, start reporting again, phone rings again. You're just like... And the most frustrating part was, after about 3 hours of this happening, obviously I haven't reported much.
Yeah.
Because I've been answering queries.
Yeah.
And then what starts happening is people who'd had scans done, their doctors start ringing up being like, where's the report?
Fine.
And I remember thinking, if you just shut up for 10 minutes, I could give you the report.
Because they're all going to call and be like, why is it not done yet? Why is it not done yet? But if they just didn't call, you'd have time to at least do one of them.
Exactly. So I remember being in the situation, I was like, this is a catch-22. It's like, how do I get out of this? Fortunately, after maybe a couple of hours, that stopped happening, so I could just work my way through. And my consultant helped me out.
Yeah.
But yeah, I didn't expect that many phone calls. I think it does get easier because the problem for me is I don't know the answer off the top of my head for a lot of the queries. So let's say they ring you saying, can you do this type of scan for this type of patient? What you got to think about is A, is the request appropriate? And B, is the right type of scan to do? And how do you protocol it? And sometimes I just don't know the answer.
Okay.
So then I have to look it up, think about it. Whereas I imagine if you've done that a few times, you can just say, yeah, do that.
When that same request comes back, you'll know, yeah, we can do it, or no, actually,
exactly. So like a 30-second phone call for me can easily turn to like a 3 or 4 minute phone call, which makes things a lot harder. The other thing which surprised me, well, not surprised me, but because I was expecting it, but kind of is a bit disconcerting, is like we were saying before, the level of responsibility given to you.
Yeah.
If my consultant's away and other registers away, I can get these like senior surgeons, senior consultants calling me saying, oh, can you do this scan please? And or I've reported the scan saying, oh, what do you make of this? I haven't got a clue sometimes.
What I thought is on the report.
Yeah, what
more do you want?
Like, I've done the report, trying my best, and they call me being like, oh yeah, thanks for the report, what do you make of this? Like, well, I don't know. Or even them like asking me for scans.
Yeah.
I'm like, you've been a consultant for 20 years. I'm an ST2.
I'm not going to say no.
I'm not going to say no.
Yeah.
And often they will just take your word for the report. So like I said before, you release a report and maybe a couple hours later the consultant will get to your scan and check it.
Yeah.
But in those 3 or 4 hours, they will just act on your scan.
Especially in like surgery, if it's like rapid stuff, they could be in theatre by the time your consultant sees the scan.
That happened at the weekend.
Yeah.
So a couple of patients, I said, oh yeah, there's a perforation or this or that. Patients in theatre, by the time the consultant checks the report.
Yeah.
So obviously they're acting on your scans.
Yeah.
I mean, don't get me wrong, they will take you with a pinch of salt when they see Varun Misra ST2 written on.
But if it like backs up what they think, then they're not gonna.
Yeah.
They're not gonna think, oh wait, I better wait for the consultant.
Exactly. And surgeons notoriously rely on CT scans. Quite a few phone calls from the medics saying, patient's got query perforation, but the surgeons won't take them unless you do a CT scan. Felt quite bad for the medics, but is what it is.
It's a medical problem unless proven otherwise.
Yeah, that's kind of what the stance seems to be. So yeah, I was a bit disconcerted by the level of responsibility given, but I suppose that's the nature of the job.
Yeah.
It's just, you get used to it.
Yeah. And I guess the more experience you get, the easier it becomes as well. Because you, at some point, you'll just seen it all before.
Fingers crossed.
Yeah.
You do see some consultants who've been working for like 30 years report a CT trauma in like 2 minutes, and you're like, how are you doing that? It's like, yeah, fine. But yeah, they were the 2 things that took me by surprise a little bit.
So, it sounds like you had a great time. I mean, it was hard, but you had a good time.
Yeah.
Anything you didn't enjoy?
Phone calls were irritating but necessary. I wouldn't say I didn't enjoy them, because it was, again, learning opportunity. I'll tell you what I didn't enjoy. I'll tell you what I didn't enjoy. And we've all been there, so I'm not having a go at anyone. So, oftentimes you get phone calls from junior doctors.
Yeah.
Usually FY1s. And you know it's the FY1 because they say, hi, I'm one of the doctors.
Yeah.
If you're a registrar, you just say, I'm one of the regs.
Yeah.
One of the doctors means, I'm an FY1, but I'm trying to pretend.
Yeah.
And they don't know the patient. They don't know what scan they're requesting. They don't know why they're requesting it. They don't know anything about the patient.
Yeah.
My consultant wants it.
Yeah.
And look, we've all been there. I'm sure you have as well.
Yeah.
Like,
Consultant says on the ward round, just get a CT for this guy, and you kind of haven't really listened, or you're just catching up to the ward round. You don't know what organ you're CTing. You have no idea what's going on. So you just call up radiology, like, yeah, we need a CT tap. Yeah, just do everything.
So I try to be very patient with them.
Yeah.
You know, why do you need the scan? What's your clinical question? What are the bloods? Is the renal function okay?
So overall, it's quite a good experience then, would you say?
Yeah. Like I said, I was looking forward to it. It was tough, but everyone does it, so obviously it's very doable. I learned a lot. I feel like my CT skills have already improved, which is really good.
Yeah.
That was my video about my first weekend on call. Hopefully you guys found it interesting. If you guys got any questions, comment box down below. Any other video ideas you've got for either radiology or for psychiatry, again, comment in the box down below. If you like the content, please give us a like, give us a subscribe. Like we keep saying, more than half of you watching are not subscribed.
I think it's like 60% of people
Is
watching
it?
these videos, yeah, just aren't subscribed.
Come on, just press that button.
Yeah, it doesn't take long.
It's not that deep.
Click it.
Yeah, but apart from that, we'll see you guys next time.
Yeah, see you later.